participated, who made our name, and also the industry are happy because we could give them good scientists. So I don't know whether you are able to hear the voice or not. So not.
Yeah, we can hear.
No, the computer voice, the clapping and all those things. So,
no.
So let me introduce briefly IPA MSB. This is an autonomous status. The college is 60 years old, 65 years old. Got a status from 2019-20 for 10 years as an autonomous, which is a good recognition, and that's why they could start a lot of courses now. And it's the only college in India awarded Best Industry Linked Institute in Pharmacy Mentor category by AICTE C2. Okay, so it is not only being the best, but it has also mentored few colleges to become best. It received the 13-14, the Best Industry Linked Institute in Pharmacy category from AICTE. It is ranked as 6th best pharmacy college in India by NIR, and it is autonomy granted by UGC. It is also basically Rashtriya Uchchatar Shikshan Abhiyan, that is RUSA registration. Not only that, the NAC accreditation is required for most of these categories, and that has been done by this college. And the college now has earlier was having 60 input, now they are having 100 inputs from last 2 years. And now there is a whole change in the college, and one should revisit the college again to see the newer things. Cyrus sir, can you just allow the entry of people of others? Thank you.
Sure. I'm not able to see anybody. I have logged in as guest.
Acha. So I would request then Madhur madam or somebody else, if somebody is coming in the lecture, please allow them inside now. Okay. Navigo is basically database. Okay. Thanks. Navigo is basically database decision provider with strong domain knowledge and assists using the data analytics to enhance operational excellence and strategic growth. It also assists hospitals in dashboarding and P&L management. And we have a lot of other apps and other things for the service of sales marketing guys. And supply chain management, sales for excellence is our basically forte. And we also conduct training programs in corporates. There are various pharmacy industry projects which I will share afterwards. We will not bore you to you. The faculty which has supported me throughout from the founding members, and I'm very happy. Right from Sandeep Rao sir, whom we have met, founder and CEO Going Digital. Myself, then Cyrus sir is there, who is student for life. You must have seen his LinkedIn, and most strictest person, but I don't know why students still like him the best, because I get the best feedback for him every time. And Raju Kevda sir, he's a Tableau master. So he teaches Tableau, Python also. This time Nainil sir is joined us, who is also teaching Python to us. Dr. Madhur Kulkarni, she is HOD Pharmaceutics from Indira College of Pharmacy. She teaches statistics. And again, she is very passionate. She and Raju sir, their session always are more than whatever they are allocated. They take 2 sessions more for the students every time. And Mahesh sir is there, CEO of PharmaTrack Technologies. So he also is guiding students for sales and marketing and the deeper subjects of forecasting and basically really getting into how pharma works. I'll just take 1 more minute to thank our inspiration and support. Dr. N. Sivaprasad sir, who is also here now, is our President Research Society of BCP, but more important, he's a President for IPA Maharashtra State Branch. And he's like a grandfather and helps us and supports us. He was the first encourager who said, yes, we should start. And followed by Nitin Manyar sir, who said, you start with BCP and whatever you want, all the facilities will be provided. You don't have to worry about cost and other things. You first start. So then every time he gives a good guidance in management, how to do that. So I'm very happy for him. And Dr. Krishna Priya, she is not here because as I told you, Dr. Krishna Priya, Vaishali and all, they are busy with PhD students today. But she is one thing who academically created the course very nicely, told me how to create a course, told me how to present to the autonomic academic body and get it approved. And not only that, she monitors every course and tells me that what I'm missing. So in every batch you will see she is behind and she tells me that exam is not taken, exam is taken, this person is not attending. So her feedbacks are always there. And I'm happy that Dr. Krishna Iyer sir is come with us as in charge principal and he is publishing and recommending this course to many students. And his support is much varied. He's more scientific in nature and he's very blunt and frank. That's what I like him most. So these are our inspiration and support. And I would just request Dr. N. Sivaprasad, I will not go into detail, but he's more senior person from BARC. He has done his PhD chemistry from University of Bombay, postdoc fellowships from Canada, 35 years of rich experience in radioimmunoassay, a lot of awards he has got. He has 2 patents right from Indian Patent Office. And he's a visiting faculty guide and editorial committee on many publications and retired as former senior general manager, radio pharmaceutical production. And I would request sir to speak some couple of minutes, and then I would request Krishna sir, because he wants to leave. So, and after that, I would like to hear from Nitin sir, because he is also joining in a short while. Yeah, he's joined. Welcome, sir. Thank you. Thank you, sir.
Okay.
Shiv Prasad sir, over to you, sir.
Very good morning to everyone. Thank you for this invitation. And on behalf of IPA MSB, I welcome you all. A special welcome to our chief guest and other invitees to this function. And in fact, I am very happy that this course added one more feather in the cap of BCP Pharmacology of Pharmacy. This is the flagship of IPA MSB. Then I congratulate the Mr. Ashish and all our faculty who are eminent and expert in the field, and for completing for imparting the knowledge to the students in this course. And also congratulations to the students for successfully completing this course. And now you can add to your biodata. And as I appreciate you because you have the desire for acquiring the knowledge. And as Mr. Ashish has told that somebody is in connection with the initial introduction, that is a student for the life. So that is a very important. One should be student for the life. There is a saying that health is wealth and time is money, knowledge is power. Power will empower you. So you should have the attitude to acquire knowledge continuously. That will also help in the career prospects. And coming to the data analytics, we put that future of to indicate it in the schedule for me, the future of data analytics. But unfortunately, I am not an expert in the field. My knowledge is maybe very superficial. Whatever I heard from this attending this valedictory and inauguration function, whatever the information I collected from that. So I am not going into the deep into that, and our time is also limited. But anyway, as you know, all that data analytics is a very emerging field. It is in the infancy state, but fast growing. So scope for the data analytical, both technical and the job opportunities are extremely good. This scope will further increase with the new techniques emerging from the computer science, computing power, statistics, quantitative analysis, machine learning, etc. So one has to see that this course is only a foundation for you, and you need to build up the superstructure further. For that, you'll have to also take the knowledge from the other areas of the science, which is related to data analytics. I feel logical thinking and with the computing power will create a revolution in the data analytics. And it is a profession of the profession of data analytics is in fact fulfilling, and it offers many opportunities. And in LinkedIn has published a small data, and as per that data, it is said that 15% growth is there in the data analytics job opportunity. And during pandemic, every job has declined. The job opportunity has declined in every field, but data analytics and other data related science have been kept in pace with the time, and it was growing. And the extensive use of data, even in Indian business, ensures a high employment with the high salary, and it's also helped the individual to connect the other technologies, and data analytics enable the business to capture more data and thereby helps the business to grow further and develop. So, but when it comes to the technology of the data analytics, I do not have much idea how advancement will be made, but definitely it will be growing. But one area which I am looking at is statistical modeling. Statistical modeling is very important, even in the science, though it is an approximation. Unlike mathematical modeling is always, it is more difficult, and we'll have to include many parameters and factors into consideration. But these factors, we do not know how they are influencing the data. It is very difficult. So the statistical model is done. Even in my experience in nuclear chemistry, even radioactivity is explained by a statistical model, something called a Poisson distribution. And So these models the data analytical may be able to improve these models further, and thereby it will be able to get an accurate prediction of the information or data. So this is the one area I am very much, my also interest as a researcher, I am interested in that. So another one area is that multi-factorial analysis. That is, in any data is influenced by number of factors, the multiple levels. And now we have got a limit to say maybe around 10 factors or 15 factors we may be able to handle. But with the help of this data analytics, I'm sure that it will be able to handle much more number of factors. Our experts will be able to tell about this. And this is another area which I feel that there will be a progress, technological progress in the data analytics. So with these words, once again, I congratulate all the students for successful completion of the course. Thank you very much.
Thank you very much, sir. I am happy that in spite of your health, you have been able to come and deliver the more scientific inputs to us. Thanks a lot. And next in our session, I was planning to have Nitin Maniyar sir, but Krishna Iyer sir has requested. So I would request for Krishna Iyer sir to speak and then come to Maniyar sir. So I just like to speak about Dr. Krishna Iyer sir, who is a student of Bombay College of Pharmacy. He was my teacher also. He has taught me. And I'm happy that he is a Mumbai University student, but a PhD from University of Minnesota PharmChem, and postdoctoral fellowship he has done in UWash, Seattle. Also, he has done postdoc in Park Davis. And after 98, he came back to India. He's the first person who that time people were trying to wait there. He came back. And since 98, he is still date with Bombay College Pharmacy. And he is more into, I would say, micro knowledge and thinks about 360 degrees for whether it is administration, whether it is a PharmChem, which is his favorite subject. And he also was having extracurricular activities as Minnesota President, Student Leadership and Service Award he has got. He was elected to Who's Who among students in American colleges and other universities. He also edited a lot of journals, including IJPC, PS, and he was co-editor in Asian Chemistry Letters. So he is into academics to a very, very depth. He knows what I would say the academic bureaucracy also very well, and he knows how to admin the college also. His teaching duties include PharmChem, pharmaceutical biotechnology, basics, biochemistry, basic and advanced drug metabolism, and pharmacokinetics. And he has many, I will not be talking, but most of our teachers have a lot of publication, presentation, patents, and awards. If I start reading that, it will take a lot of time. Instead, I will request sir to speak few words before our students and also for our chief guest. Sir. Thank you very
much. Thank you, Ashish, for kindly allowing me to kind of change your schedule, and also thank Chairman sir, Maniyar sir, for allowing me to talk a little earlier. First and foremost, I would like to congratulate all the students for undergoing this course, and I'm pretty sure all of you already feel that you are a little ahead in terms of your knowledge kitty based on what you started with. So just to give a different flavor, yesterday we had a team from Indiana University and Purdue University visiting Bombay College of Pharmacy, and actually talking about their college or their university as one of the points or one of the places where our students can come to do masters or PhD. And in terms of some of the programs that they were kind of putting forward to attract the talent at Bombay College of Pharmacy, there were two very interesting examples they gave. Okay, one was a interdisciplinary research where a professor from the physics department was designing high-resolution microscopes, which are able to actually resolve images at the level of the tissue. And this gentleman or this scientist has collaborated with a person in pharmacology to actually insert this microscope in the rat skull so that you can observe the rat brain as the rat is going around its normal activities, or when the rat is given drugs or whatever it is, and to see what changes are occurring at the level of the brain in a physical sense, okay, using this high-resolution microscope. But the interesting part is a typical experiment of this type when it is run for a few minutes, gives you data which is in the range of terabytes. Okay, and neither the physicist nor the biologist know how to handle that data. So the third person who is an integral part of this project is a person who is from the computer science department, who is into big data analysis, who is able to make sense of these million to 5 million data points which are generated over maybe a 10-minute experiment. Okay? So you can see where data analytics can play a role as you are trying to develop drugs. Okay. The second project, which was very interesting, was a scientist who was looking at how DNA, which is found at crime scenes, okay, for example, a murder scene or a robbery scene, can be used to actually profile the person whose DNA has been left behind. So now we are not only talking identifying the person, but also based on the DNA, giving you things like how this person might look, what might be the height, based on the DNA information that you already have. Okay. Again, to do this, you need very high level of data analytics or capacity to work with data. Okay. So what I'm trying to tell in a sense is, on one hand, to come up with a drug, you need a high level of data analytics. But later on, when you're trying to market it, you need another level of data analytics to figure out where the market is, who is your stakeholder, how to advertise it, how to find out the doctors, how to monitor what is happening a little later. So in a sense, the entire spectrum of the business of drug discovery and development will not function correctly or optimally unless you have people who analyze this data. Not only from the perspective of finding out what drug to develop, but how to sell it and how to market it and how to look at what your competitors are doing or even how your organization is running. So I'm very envious of this population in a sense who have got a flavor for what data analytics can do based on one facet which you have been exposed to by all the teachers who are part of this course. So I hope you run with this and kind of not stop at this point, but get into more aspects of data analytics and see the varied applications it can have and maybe use it to further your career and boost basically your contribution to healthcare in a sense. So I congratulate all of you and wish you all the very best. And just to let you know, how much ever your teachers will try and do, because of the limited time period, they'll be able to focus on certain aspects of data analysis. But it's a much wider field. But now that you have got that initial foundation, sky's the limit for you. Okay, so it's now left to you to take it forward and get into more in-depth and of data analytics and also in terms of the wideness of the application. So all the very best and have a great time in the future. Okay, thank you.
Thank you, sir. I think Maniyar sir also wants to add. What you have spoken about DNA profiling is a news to me also. But before I speak something, I would request sir, he is our chairman, sir, would like to speak for a minute. Yes, sir. Sir, your voice is not audible. Sir, your voice is not audible.
Audible.
No, not yet audible, sir.
Voice is not audible. You are muted.
Hello.
Hello. Yeah, now it is audible.
Before Dr. Krishna here leaves from this today's August gathering, I would like to wish him the many happy returns today. Today is the birthday of Dr. Krishna here.
Oh, happy birthday, sir.
Happy birthday, sir.
Thank you. Thank you very much. Thank you. Thanks. Thank you.
And thanks. Before you leave, can I have a group photograph for the students? Can I request all of you to put on your video for a minute? We'll have just a good group photograph for a minute before we start. Yes, all of you, Satish, Aarti, Amrut sir, Medhekar sir, you also. If you can just give us your snap. Aarti, Ashish, Supriya, Pranita, you also can join. Rutuja, Bhageshri, if possible. All of you. Yes, thank you. I would request Cyrus sir also to take a photograph. And thanks a lot for all of you to be on the photograph. But I didn't see Aarti and Rutuja and Bhageshri who are a part of this group. So we would like to keep. Nali, thank you. Okay. Thanks a lot, all of you. And I would request then, sir, to be here. Krishna Iyer, sir, you can switch off your video, but you should be here.
Yeah, Professor Iyer,
I would like to.
Krishna sir, happy birthday.
Thank you. Thank you. Thank you.
birthday to
Thank
you.
you.
And we can always take inputs because Purdue, I was told by sir, but Purdue has done this things which you are talking about is much ahead than what we are planning. And I think Dr. Medhekar will also add something because 25 years of rich experience is there, but he is more into practical aspects and application aspects, not into the scientific aspects of it. So we'd like to hear from him also that time. Thanks a lot, all of you, and we'll carry with our program, sir. So the next speaker, what I was sharing with you, is our mentor who has always supported me. He's a community pharmacist. He has his own chemist shop. But more than that, he is always 24 hours busy. It will be shocking to hear, but I think he must be speaking 4 or 5 hours only. And he is doing too many things in various areas, including our BCP and IPA. He is also doing many other things. He is a SEO and governing board member for Government of Maharashtra, Maharashtra State Board of Technical Education, PCI, Maharashtra State Pharmacy Council. So he's on most of the bodies. He's Honorable Secretary for RDCA and Northeast Zone Chemist Association. And Medhekar sir can always take his help for anything which you need. Anything. Then he's also Krishna sir, your voice is unmuted, not muted. Then he's trustee for Sarvodaya Hospital, Samarban Blood Bank, Samarban Thalassemia Day Care Center, where more than 150 thalassemia patients are there, and they are getting regular blood in a month 4 times to 3 times. And not only that, they also run a dialysis center, which is at a very economical cost. He's a CEC member for IPA, Honorable Secretary for IPA Maharashtra State Branch, and he also ventures into various IPA MSB activities. He's a chairman basically of government body, Bombay College of Pharmacy, but there are various other IPA MSB runs through BCP. That is Research Society of BCP, Amrut Medhekar, AMRF, then Dr. M.K. Ranganekar testing. This is an official testing lab wherein the licensed testing lab for many of the pharma items are there. But ACE is there, Academic for Clinical Excellence. He is running that. Plus, he is looking after the further growth, and he is having a 5-year plan for BCP also, which is there in his mind. Let us listen to him, and I would like to hear from you, sir, to guide us to our students. Thank you, sir. And
thank you.
Apologies because I didn't see you. I asked Krishna sir to speak before you.
Thank you very much, Asaji, for the brief introduction of mine. So, good morning to all, and respected Sri Amrut Medhekar ji, President, India Business, Wockhardt, for gracing the today's valedictory function. Friends, today is the first day of the October, and Latin meaning of the October is 8. The number 8 is to be the symbol of the wealth, prosperity, peace, and the fertility. It's a great moment for me to be the part of this valedictory function of the 8th successful batch of the data analytics and healthcare, first of its kind in India, and I congratulate to all the participants for the success. I would like to acknowledge the untiring efforts, the consistency by the team Navigo, and in particular, the SSG, along with the cooperation and the guidance received from the professionals. It is understood that out of the combination of the participants from the ECOM, hospital pharmacies, and IT professionals, one of the participants got promoted from the sales to marketing in the renowned corporate, which is a lifetime opportunity as expressed by him. He could crack the interview due to the knowledge acquired in the analytics for the database decisions. We, along with the Navigo, have initiated the thought of empowering the pharmacy and allied students and the professionals with the digitalization and the data analytics knowledge during December 2019, and created a relevant syllabus for the certificate course in data analytics for the pharma and healthcare sciences and professionals. Friends, data analytics science have proved time and again about its importance, and during the recent pandemic also, and thus our country become the more superior in the pharmacy for the world for uninterrupted, timely, and affordable medicine and the vaccines. Thank you, and wishing all the best to participants for their future journey. Thank you. Thank you very much.
Thank you, sir, for this power-packed and brief inputs which you have given. And we are happy that you've always been supporting us and motivating us, not only through some directions which is needed by the technical board, but also through your commercial confidence that we should not worry about. And that's the reason we are consistently going ahead without any worries. And we know that we always can depend on you and Bombay College of Pharmacy and IPA MSB for anything if we need. And also, I'm happy that you are also promoting the Excel course to various colleges, that they should come as a pharmacist with Excel knowledge so that they get good jobs. We are very happy for that, sir. And thank you very much again for your address. Now, let us go ahead, students. Dr. Krishna here has already shared with us. So in the certificate course, what we are going to speak, we'll just take faculty feedback for a minute and students feedback, couple of them for a minute, and then we'll go ahead. So I would keep, because teachers have educated these students who are joined today. So what are their observations? It is more important for us. So I request Sandeep sir is not there. So Cyrus sir, if you can just, we'll take a couple of students, couple of faculty and couple of students. Over to you, Cyrus sir. Cyrus sir teaches machine learning and he is one of the most senior most faculty with us. Deep knowledge into, he's an ethical hacker, NLP, deep learning, and you name it, and he is expert in that area. And his experience is 15 years. He's academic 15 years in his own business of Next Data, which is one among top 10 machine learning company in the Indian business. And recently they got an award also. So over to you, Cyrus sir. Sir, you are on mute. Sir, you're on mute.
Thank you so much, Ashish sir. Students, congratulations on passing this certificate in of data analytics in healthcare. You must be proud. You should be proud. But don't sit back on your laurels. Remember, the industry is respecting you today because you are learning a new technology. You've learned a new technology. You've learned cutting-edge technology. If you sit back on your laurels and don't keep learning something new every day, industry is going to leave you behind. So, a day which you have not learned something new is a wasted day. If you follow that paradigm, it will help you in the long run. Second thing which I would like to impress upon you all is practice. Data science and tools like Excel, Python, machine learning, if you don't keep in touch regularly, you will forget. This is not like flexibility for life. It needs regular practice to keep in touch. You open Excel after 1 year, you will be blank. So please, please, please learn something new every day, practice your old stuff, and you will be set for life. I'm sure industry is going to accept you and give you many, many opportunities and many, many more promotions and raises. All the best to you guys. Over to you, Sashi sir.
Thank you, sir. Thank you that at this experience also you are motivating and power punching the students to take this course ahead, and which is I also feel that yes, they should take this course ahead. They should get into some niche and become expert there. But at this juncture also they'll get good jobs. I'm sure of it. Thanks, sir. And I would request our Madhur Kulkarni madam from Indira College of Pharmacy. She is Professor of Pharmaceutics, head of the department there. And she teaches statistics. She is also like him. She is having a mixed experience of 10 years in industry, 10 years into academics. So she comes from both the sides and applications are also there. And the passion which she teaches is excellent. And she wants also this to be promoted to many students, which I'm happy about it. Over to you, Madhur madam. I think your focus is not coming of the camera.
Is it better now?
We are able to see you. I think you will have to come a bit closer to the camera.
Okay. Yeah.
Because,
This is the closest I can be to the camera. Okay. So, very good afternoon, all the participants and all the dignitaries present on this virtual platform. It's really my pleasure and privilege to be a part of this certification course. And I really appreciate Mr. Ashish Baptiwale for his commitment and involvement. He's there every time, every evening. He is spending the time with the students as well as with the faculty. So hats off to Mr. Ashish Baptiwale. I mean, just to tell to the participants that you have done one of the most rigorous, I can say, most rigorous and demanding courses. You would have experienced every day learning something new and something which is going to take you to the heights. So this is the course which is going to be the course of the future. And then you've already embarked upon it, and that really crafts your journey ahead. And I wish you all the very best. I'm sure anything and everything that you learn never goes waste. So whatever you have learned through this course, if not today, maybe few days or few months later or few years later will surely come handy to you. So I wish you all the very best for all your future endeavors. Thank you.
Thank you, ma'am. And thanks for those good words. Though all the whole team is taking equally passion that they are available to the students at any given time, at any number of times, and they don't mind repeating and teaching things. So the passionate faculty is what is my asset, and I thank all the faculty also. Nainil, you would like to speak one or two words? Nainil has joined us this first batch. He has not trained you students, but next August batch, he is trained for them for Python. So Nainil, you are there?
Yes, sir, I am there. Yeah, I won't be able to turn on the camera.
Okay, no problem.
Yeah, so nothing. It's been great. I have been teaching Python to this August batch, and it has been great till now. And machine learning and data analytics. Even I am the place where I'm working, right, as an intern. Even there, we have a heavy use of data analytics, right? And we daily collect data from different sources over the internet, and we scrape them, and we pass it on to the data researcher teams and all that stuff. So real life applications are numerous. If you go over the industry and you see how data has been used and data has been analyzed, it's really fascinating. And I've been a huge fan of Python, and I've been learning and exploring Python from like 4 or 5 years of my college life and career. So yeah, it's been great teaching students Python, and it has been a wonderful journey for me till now. Yeah.
Thanks, Nainil, for your feedback. Mahesh sir has just said here too, because he is also in the office. So Mahesh sir is apologized, and he says he will join if possible later. I would like to hear from him, actually speaking. But let us go to the students' feedback. Couple of students, they can give a feedback. We are proud that for every batch, before our valedictory function, before even the batch gets over, few of the students get job or few of them get promoted. This time there would have been 2 students who would have got the job in data analytics, but however it has been delayed. And Satish Kumar, who comes from sales to marketing in Boringal. So we are happy that he also got promoted, and with his dedication, because he used to every time present how he is applying the knowledge of presentation, Tableau, Excel, and that his enthusiasm was looked into. So the part of the course also, if you do it very nicely, how it can change a life. This is a good example. I would request Satish Kumar to give his experience in 2-3 minutes if possible. Over to you, Satish.
Thank you, sir. Thanks, sir. First of all, Bombay College of Pharmacy and also Ashish sir, NavigoAnalytix, for starting this course. This is very much useful for especially all the pharmacy students or the pharma background people, whether they are in the R&D or they are in the sales or marketing anywhere. This course will be definitely very much useful. So like my experience with this course and my feedback will be like, see, I'm into sales from the last 9 years. I work for companies like Sanofi, Lupin, Abbott, and currently from last 5 years I've been associated with Boehringer Ingelheim. So I was looking for a project within my organization where I can get an opportunity to work as a brand manager from an executive level. So I was currently working as previously I was working as a business development manager into sales in Hyderabad, but I was trying for this opportunity. So I enrolled into this course and I was able to crack the interview process. Once I have done the course, it was very easy for me to crack because I applied for this opportunity 2 times. First time I missed uh, with lack of some of the skills, especially related to Excel and also this analytical skills. So when the next time I have applied, it was like easy for me to clear the interview process. Whenever questions related to Tableau or Excel or segmentation related questions, CMark data related questions, I was answering for even 2 to 3 minutes. I was going on. I was not stopping. Especially thanks to Cyrus sir, because that has really made a difference when compared to other colleagues who were part of this interview process. I was in top 5 for the interview the first time also, but I could not clear it because of lack of the skills. So I definitely like suggest all the students also to take up this, and like I have given like most of my colleagues also ask me regarding this course. Hope they will contact you, sir, Ashish sir, in a couple of days,
Sure.
because
Sure, sure.
I have given your contact number to them. And thanks once again, thanks to Bombay College of Pharmacy and Ashish sir, definitely. And one more thing I would like to share, Ashish sir, is that even my marketing manager, he just joined couple of months back. I will be working under him. He has selected me for this position project. So he is also from Bombay College of Pharmacy.
Oh, what's his good name?
His name is Benil Balakrishnan. He is a 2011 batch out, pass out batch out. He has done his B Pharmacy there. So he asked me regarding this course during the interview process also. And he knows Mahesh sir also personally. So he asked me about you also. And he like he said that you have taken a good decision by taking a course, certification course from a very good college during the interview process also. So thanks.
You don't know that. You don't know that. But what you have talked, you have been a big brand ambassador for our course, and a good example which I should quote for people. You are so passionate and you are so involved. I am happy that you are giving credit to us, but it is your passion and your involvement which has made you take that, because you wanted to reach there, and that's what is more important. So thanks. You have been.
Thanks.
You have been. I felt very much that we are hearing too much. That's why I thought let us. Yes.
Yeah.
So
Yeah.
thanks a lot.
Thank you.
And I think Mahesh sir has joined us. So let us hear from Mahesh sir, because I told him that you appreciated him also. He is also here. Mahesh sir, over to you, sir.
No, I'll just take a couple of minutes. I'm so happy to hear students talking about this course and how this course has really helped them. One thing I can definitely say that this course is, I think, one of the best courses in the country, especially in the data science and data analytics in the healthcare sector. There are so many students and candidates that we keep interviewing, and many a times we actually reject the candidates because they lack basic or advanced Excel skills or Excel analytic skills. And when we get people who have got healthcare knowledge plus such a great data science and data analytics experience, there is nobody who can say no to such students. I have personally recruited a couple of them from this batches itself, so I'm very happy with the way students are picking up, the candidates are picking up the skills, and all the faculty members are training them, teaching them, and getting them ready to take the challenges in the industry right now. So especially this batch, I'm really very happy, very impressed with the kind of questions that I had, the kind of interaction that I had, and I wish all the best to you. If you need any support from me, any guidance, anytime pertaining to the knowledge or pertaining to jobs, I'm always, please, connect with me. Thank you so much and all the best. I want to hear, listen to Amrut also very quickly. So all the best to you.
Thank you. Thanks. And as I tell all of them, Mahesh sir is one person. Even a person is coming from research background. After his session, and I kept his session purposely at the end. After his session, everybody wants to go to sales and marketing, and that is what his skill is. And I tell people, in storytelling in data analysis is more important, and the presentation how you should make, they should learn from him. He is a very good presenter and a storyteller. Okay, thanks a lot. I think Rutuja, I would just request you for 2 minutes if you can speak, or anybody else, because we are running behind schedule. And we had a very young student, second year pharmacy student. She also, Akanksha also joined us, and she is also happy. In fact, her teacher has asked her to present. That's what she was sharing with us. So either Rutuja or Akanksha, anybody can speak for a minute. Yeah, Rutuja is here. So Rutuja, can you tell about the course and whatever you are expecting or what we should modify?
Yes, sir. First of all, good afternoon to all the dignitaries and my colleagues. I'm really happy to share about this course that I have choose this course and I have successfully completed it. It was a very interesting and a different course as I was in the just B pharmacy and not from the industrial background. It was an excellent, insightful learning experience and rewarding too, since it gave me a clear as well as good groundings in the Excel analytics, statistics, Python, Tableau, machine learning, Power BI, digital marketing, and many more in the with the real-time examples. And the heartful gratitude to all the faculty members, Ashish sir, Cyrus sir, Mahesh sir, Raju sir, Sandeep sir, and Madhur ma'am for encouraging and giving us the constant support. Thank you. Sir, you are not audible.
Sorry, I am happy about the confidence with which you are speaking, and keep this up. And it is needed in storytelling, and for data analysts, this is much more needed. When you stand, people should feel that yes, whatever you speak is the end, and we have to listen to it. So good, there is a sea change in you, Rutuja. Thanks a lot. I think we are running behind schedule, so I will not.
Thank you, sir.
Thank you very much, Rutuja, again. So after faculty feedback, we had a student feedback. But let us now, for all, we are waiting to hear from Amrut Medhekar. Amrut Medhekar sir is a president in India business. I had a brief opportunity to work with him in Zydus also. And he had a big career, a long career in Zydus. He is a doyen in pharmaceutical industry with more than 25 years of experience. Though he worked from sales, marketing, business management, his whole focus is always commercial, that is P&L. And that's what companies like about him. So as a core marketeer, he established multiple acute and chronic therapy businesses and brands also. Okay, in gastro, he was known figure, in fact, in Zydus. So Tauren and Ranbaxy Zydus he has worked with, and now he's with Wockhardt handling their India business. And in Indian pharmaceutical business, you ask any company people, and he's known to them. And as I told you, I know him for P&L and sales, basically. Though there are brand building and customer in gastro and other part, you will see customer connect is very good. That doctors know him by name. He focuses on building the sustainable business, not one-time business. So he was also focused on processes, and therefore he uses data and digital things to a greater extent. I heard recently from him that he had been a big contributor, wherein multiple pharma companies had come together to create a strategy for data and digital in our current scenario during our COVID times. He is also people oriented and therefore always focused on developing people for business performance. And he wants me also, he had called me because he also wants his people to use this knowledge and get help and improve his business. He regularly interacts with students like us and from multiple institutes and platforms. He is more into industry academia connected, and that's why I requested our principal also that we can connect with him and see how we can take advantage of his knowledge for our college also. As a salesperson, he's there. He loves traveling, no doubt about it. Reading is his passion. And I liked him. We are always in touch regularly, in spite of me leaving Zydus around 6-7 years ago. And that's how you can know that he is a network person throughout. I'm happy that we are having such person who will be sharing his practical thoughts to all of us students. Very important. And if you feel, you can still connect with him anytime to get more knowledge or to even get good connect and even jobs also. Just on a lighter side. Thank you very much. Over to you, Amrut sir. We would like to hear from you.
Yeah, thank you. Thank you so much. Can I share the screen?
Sure, sir. I'll just stop sharing. Yeah, please.
So is it visible now?
Very much visible, sir. Your office is visible in a great way.
Okay. Thank you so much.
Towering personality of your office.
Yeah. So before our name, always the organization precedes. So this is what Wockhardt is. We are a life sciences company, but spread across not just the pharmaceuticals, but healthcare as well as welfare. So Wockhardt Foundation is the second largest NGO foundation in the country in the healthcare space. And besides that, we have our own hospital chains and also in the pharmaceutical space. It's been almost a 50-year journey with almost 25 countries where we have our physical presence of our own employees, and total of 37 countries. So that means 12 countries we don't have our own employees, but we operate through the importers. Around 3 R&D facilities and 12 manufacturing facilities across the world. We are the only company in India who have been able to deliver research molecule in antibiotic space, a patented molecule, which is a proud moment for the Indian pharma as well as India as a country. And the 4th company in the world to get a 6 QIDP approvals from US FDA. So that's a fast track approval for any new molecule, research molecule, which US FDA feels is meant for immediate launch. And also, we were the first biotechnology company in India to produce human insulin, including glargine, which is a long-acting insulin. And close to around 3 million lives we have touched through our Wockhardt Foundation. Today, almost our business is 80-20. So 80 is outside India borders and 20% from India market, which it was reversed a few decades back. These are our founders, Dr. Habil Khurakiwala, Dr. Murtaza Khurakiwala, Dr. Zahabia, and Dr. Uzaifa. So it's a family of doctors. So each one of them handle one vertical. So Dr. Uzaifa looks after the foundation part, Dr. Zahabia looks after the Wockhardt Hospital, and Dr. Murtaza look after the pharmaceutical business. This is how the global footprint is. In terms of red, what you see is where our direct operations are. Blue is where we are present through our importers. And coming to some of the things which I highlighted, so close to around 850 scientists we have on board. Besides, of course, a lot of CROs work with us on different research and development projects. And we have our research center across UK, US, as well as India. This is what I wanted to bring in. So many of you would know that what Serum Institute was during COVID time for India, Wockhardt was for entire UK. So 70% of the vaccines to UK citizens were given by Wockhardt. And you can see the Prince of UK and the erstwhile Prime Minister also, the ex-Prime Minister also visiting our facility there. So this was again the same what we got in India, the AstraZeneca vaccine, which was totally manufactured, 100% manufacturing happened with Wockhardt there in UK. So turning pages now to what I wanted to bring in here. Is the presentation clear? Is it visible to all?
Yes.
Okay, thank you so much. So I will just minimize this part, move to the full screen. Okay. So this is where we are. In terms of data analytics, I'll come to it later on, but a few things which we all should remember that these last 2 years of COVID has taught us. One is too much of digital blasting to the customers, be it doctors or outside pharmaceutical industry, leads to saturation, and that is what is happening. So there is a digital fatigue which has possibly got into the doctor segment, and therefore people are ready for more preferred physical interaction vis-a-vis digital interaction. Second thing, we all know that pharmaceutical industry works on only one word, which is trust, because doctor looks at you and your eyes, and whatever you say, based on that, he prescribes to an unknown patient for us. So pharmaceutical is the only industry possibly where we don't see our end user or consumer. So basically looking at our credibility and our words, the doctor chooses to prescribe a particular brand among so many brands in every molecule. So I think it's a unique place to be in, and where the communication and data science will play a lot of role. Second thing is we must be proud of that other than IT industry, I think healthcare is the only industry where India is able to beat China hands down. And we should feel proud about it because today, 22% of the volume sale which is happening in US is manufactured in India. So almost every 4th pill, injection, cream, ointment, every 4th one item is manufactured in India. So I think there's a dominance there. And why I'm talking about US is primarily because US is dominant #1 pharmaceutical consumer of the globe. Another thing which is important for you to look at is in terms of patient access is increasing considerably. The government investments are increasing in both National Health Mission as well as PMJ. I'll talk about it after these couple of slides are over, more about it, but primarily trying to say that the overall healthcare access is improving. And second thing is that the market is also moving towards relatively more of prescription medicines which are generic in nature. You will find most of the government hospitals are now turned towards prescribing generic brands. Government is also pushing the agenda with almost 10,000 Janaushadhi Kendras, which are being targeted by the end of this year. And I think there'll be a lot of distribution issues which will get solved with the reach which government is trying to solve. Another thing which is happening is we have multiple portals selling medicines, but the big brands which have come into play, so the top conglomerates of the country, so you have Tata's coming into this, you have Reliance coming into NetMeds, you have Apollo Group, and then you have Pharmacist and then Flipkart. So all of these have started selling medication. So primarily we are looking at the entire fulfillment cycle happening in the pharmaceutical space. And that's where I want you to look at it in terms of what role data and digital will play. So today we are talking about a small number. The number looks very small, that it's only 2 to 3% share, which is garnered by these companies as far as the industry grows. But even if this 3% moves to 2%, that means we are talking about 2% delta on a market of close to around 1,85,000 crores. So I'm sure you are understanding the volume and scale of what we are talking about. So we are looking at close to around 4,000 crore rupees of delta being added over the next couple of years in these 5 players. So it's a huge opportunity in terms of digital payment infrastructure, digital healthcare delivery, as well as for supply chain logistics. Another important thing which has happened last week, the government has announced medical tourism policy. I don't know whether it is available with you because it has gone through multiple social media handles and it's available on WhatsApp. So maybe I'll be happy to share with you the document. I think it's a very, very good document piece which the government has come up with. Last year, we had close to around 17 lakh patients from outside Indian borders to come to India for their medical needs. Primarily, it was cardiac procedures and also the orthopedic surgeries. A cost of 1/10 as compared to any part of the world, including African countries. So I think the cost of economics, the economics play a lot of role here in terms of healthcare delivery, and I think best-in-class delivery for the patients. So I think there is an opportunity lying there. Why I'm highlighting to you guys about this is because this is going to add close to around 0.5% to 1% additional revenue growth for the pharma industry. Another thing which is happening is the robotics area, wherein you are able to do remotely high precision surgeries. So in the cardiac space, I'm sure that you would know there is a famous doctor, Dr. Patel in Ahmedabad, who has his own cardiology center. He has done a heart surgery for a patient who was lying on an operation theater bed in Jaipur, but he was sitting, the doctor was sitting in Ahmedabad. So robots performed the entire surgery based on what he was guiding from there. So I think that's a breakthrough. So that means we are talking about the primary healthcare needs to be not just fulfilled, but even the tertiary care needs can also be fulfilled remotely. So we have possibly jumped a long way as far as this digital growth is considered. Another thing which has been taught to all of us is the preventive healthcare space. So a lot of growth is happening there. In fact, I'm sure PharmaRec is looking at it. Mahesh is looking at the data sets. So this segment was on the 9th rank in PharmaRec and jumped to 6th rank. So nutritional segment has really come up post-COVID. So people are more conscious about their health. So the point which I'm trying to say is that awareness, affordability, availability, and as well as more important is access. That is improving for the patient population. So overall pharma industry as well as healthcare space is growing enormously. And there's a tremendous potential going forward as far as tech space is considered around this. There's also a breakthrough insurance coverage which is provided by the government in the form of PMJ. It is 1 rupee per day, insurance which is being provided to cover 2 lakh rupees of insurance coverage of health spend. So I think that's a breakthrough program which this government has launched, and I'm sure it will go a long way for most of our rural and semi-urban areas to access healthcare needs. Another thing which is possibly tectonic shift is you do see a lot of doctors who are passing out are not opening up their own clinics or nursing homes. Most of them are jumping into corporate space because somewhere there is a realization of the new generation to make quick money and quick brand name, because at the end of the day, the doctor practice starts only after getting into graduation and passing out after 9 years. So 9 years is a pretty long time for a doctor to start, practicing on his own rather than earning through I'll say internship in a government setup. So I think that's where doctors are possibly looking at tie-ups with corporate hospital, get their branding right, and then possibly open their own private space. So I think corporate setup is helping the hospital industry to grow in terms of number of beds and number of patients being treated tremendously. So these are, I think, some of the tectonic shifts which are happening in the industry. Now, having said that, it is important for me to come to what lies ahead for each one of you. Few things. One is that when you look at data analytics, there are three stories to this, to my mind, in the pharmaceutical space where the needle has moved. That means the industry has really adopted those things and had been using it on a real-time basis. One is looking at the data in a different way, what PharmaRack used to provide, or Mahesh used to provide, or IPA is providing us today, quintiles. And even, I will also quote about consumer data, which comes from different market research agencies. We are looking at different kinds of slicing and cutting and, presentation of that data, not just at a holistic all India level, but at a pin code level. And on a pin code level, what is the kind of spread for each brand and the competitive forces? What kind of revenue models are happening in terms of logistics? Because in the GST era, any distributor is able to supply the drugs to any other pin code outside his earlier chosen territory of coverage. So I think logistics is one place where it is playing a role predominantly in terms of data analytics. Second is in-house usage of data analytics in the distribution or logistics. So predictability of sale has to.
We lost your slides, I think.
Yeah, I'm not talking about slides now. So
okay, thanks.
I have moved away from those. So I said logistics or distribution, I'm talking about, wherein I'm saying that companies are now using a lot of predictive analysis as to which SKU of which brand is going to be sold at which CFA. Or the distribution point that you might have. So to avoid any kind of distribution costs and escalation of costs, because many of the companies are now working in biotechnology space, especially companies like Wockhardt, where we are dependent on what we call it as milk route or cold chain route, because 70% of my products, including insulin or antibiotics or critical care products, they are all sold through cold chain. So a lot of logistic cost involved. So unless you have predictive analysis, knowing the historical trends and also knowing that what kind of cyclicality is there in terms of product sales, you'll not be able to predict it in the right way. So logistics is one place which I think many of you might be interested. That's the place to be in. And while I talked about government announcing medical tourism policy, last week there was another policy which was introduced, which was for the logistics by the government. And this includes for pharmaceutical logistics as well. I would really encourage you to go through that document. It's not a very large document. It's just 148 pages, out of which around 20 are only relevant for you. So I think you can very well read up. It opens a lot of opportunities for pharmaceutical distribution modeling. Second thing, I think beyond marketing data, which I said, the sales data, the competitive data, you're also looking at doctor prescription data. And third is the logistic data. So beyond these three places, I think R&D setup, because I now also look after part of R&D that reports into me. And I was very happy to look at the kind of statistical modeling that they're doing, the predictive analysis that they're doing, what kind of outcomes they will see over a period of time. And then you have, technical graph tracing back in the history as to what has happened with a particular molecule in terms of what kind of outcomes that you expected, and then comparing those dotted lines there. So I think these are the four spaces which I have seen the data playing a key role. Since Ashish sir has already spoken about my association with one of the startup which I had, I won't name it because of confidentiality issues, but I had the privilege of almost connecting with all the 67 platforms that are operating in India personally in the digital space in pharmaceuticals, which includes the 5 which I shown you, which includes Flipkart or 1mg and all those founders and entrepreneurs I had the opportunity during COVID time to personally interact. and also virtually interact regularly on a project that I was doing on the startup space. And I think I learned it the hard way that one, you need to understand the patient psyche very well. I think that's the mistake that most of us do. So I think this will be another area of data analytics, which will play an important role. That how do you get the repeatability of the same patient coming back to see the doctor on a telehealth platform, which is a virtual clinic platform. So I think that's where the companies are struggling. That's a black hole to see. That's one area which every big organization, including Reliance and Tata, is not able to solve it today. Second space is in terms of fulfillment. So I think that is the space which most of the organizations have been able to solve it. That after you have a prescription pushed in through the system, you are able to have a fulfillment cycle of not more than 24 hours. So I think the story of Amazon and Flipkart is getting repeated. To connect the dots, that where is your logistic hub, the hub and spoke model of storage and distribution. So how fast you can deliver to a particular pin code. And there are again statistical modeling of time taken to deliver and your manpower and resources which are deployed in that particular pin code to make it happen. So I think there is a huge, I think I'm not able to express it in the right way, the way you can understand it possibly, but I'm sure that you'll get the intensity of what I'm talking about it once you think through. It's a very, very complicated process to predict. There are 19,000 pin codes in India. And to predict exactly what kind of ordering that you will have, right? It can be only done through very complicated statistical formula, which will again have a 30 to 40% error. But still you are able to save a lot of cost for the organization in terms of capital being blocked for the inventories and distribution time. Another space was the payment modeling. So what kind of revenue models are you able to create for the organization in the financial space? Because you have the fixed distribution cost, you have a fixed servicing cost, you have a fixed platform cost, and then you have a fixed payment bank cost. So, I mean, Bharat Pay will provide you only the aggregator role, but ultimately, bank will charge them. So that's a 0.2% also you have to add. So if you add up all of this, whether your product which you are working on is financially viable or not. So I think I have enumerated multiple opportunity areas which organizations are working on, many of them struggling on, many of them trying to solve through different modes. And I think we have seen some successes, tremendous successes on that. We have seen a lot of successes on the diagnostic space, which is another area some other day. If Ashish sir allows me, I would like to spend time with you to talk about diagnostic space. I think that's a great opportunity where a lot of action is happening, a lot of price cuts are happening. In fact, it is becoming very, very competitive now. Dr. C is operating at 1 rupee, home visit for your blood test. If all of you are in Mumbai, you can order it, Dr. C. You can get it free of cost for your entire family. So that's the kind of competitive space that we are looking at, because they are not doing it free of cost. They are actually looking at patient data pool to be generated. They are looking at this data set to be used for the hospitals, for the doctors, for the pharmacies, and so on and so forth. So I think there are a lot of exciting times ahead. I think Ashish sir has given me very limited time, so I'll restrict myself here. Sorry for, I think, overstepping by 5-10 minutes. And thank you so much for all the attention. And also thanks to all the faculty and the gurus who have spent time with the exciting subject, the future ready subject for all of you. I wish you all a lot of success in your career. And as Ashish sir said, I'll be available 24/7, 365 days for all of you to reach out to me for any kind of queries or career support that I can possibly help you with. So thank you so much again, Professor Cyrus, Dr. Shiv Prasad, and thank you so much, Ashish sir. Thank you.
Thank you, sir.
Thank you, sir. You said that the time is limited. That is the time I realized that I have already heard you for a long time. I would have loved you to continue. You gave a 360 degrees picture for the industry, what is happening, and few of the things which you have shared, I was also not aware of. And today there are a few more things which I learned. You have spoken few things, and even Dr. Krishna here, he has also spoken about DNA profiling. So we would like to get into that. And as you rightly said, in India, logistics and sales marketing are the topmost, which are using the data analytics in pharma industry. but we would certainly like you to come and talk to our students for the other areas like diagnostic and other hospitals, which we are also few not aware of unless we are going and consulting them. So you are also giving us good areas to think about where we should penetrate. And as you rightly said, logistics is equally important because in India we get pizza in half an hour, but medicine we take at least. You said that 24 hours is your target, so that is a bigger challenge in India. So I definitely feel that yes, we can learn more from you. And though you are very superficial in discussing the depth, but yes, we would like to know how the prescriptive analytics and other things we do. And regarding pin code, Navigo is already working on pin code wise demand generation, okay, through a certain app, one pharma company we are working with. So definitely we will also learn more from you on that aspect too. And thanks a lot for coming and for an exciting lecture which you have given. In fact, I will be tempted to ask you for your presentation because I was just listening. I did not have the data if I want to quote again. So very nice presentation. I appreciate, sir. And in a short while of 1 week, you created this presentation. I'm so happy to see and happy to see your knowledge about the subject also. Thank you very much once again to all of you. I would request you to just stop sharing if you don't mind, sir. Yeah, thank you. So I will now share because most of our part is over now, and we are going towards the important part for why we are here. So this is basically giving the certificates to the student virtually. We are going to do that. And at the same time, I would request all of you that once you receive the certificate, students, once you receive the certificate, you would like to acknowledge by saying thank you or acceptance or whatever it is, so that sir also knows that you are accepted the certificate. Second thing, sir, I would like to also mention to you, one student who is a topper in this class has not been able to come today, and he is from 1mg. 2 years he is working with 1mg at Gurgaon. And unfortunately, he is not able to come today. He has sent his apologies. But he is a topper in our current class. And he was also equally using the data analytics for their own company. Whatever we used to teach here, he used machine learning also to get some data and answers for them. So yes, we agree there are much more opportunities for us to go. So let us come to the important part. I would request sir to give the certificates to the students. And I'm happy that everybody of them has passed out successfully, and including the second year student Akanksha also. I'm so proud of her that she has done it. The batch was more hardworking, which I saw in this current whole my 8 batches. So the first student, Aarti Chavan, she is an IT student who wants to re-enter into data analytics as a career, and she has done her Master of Computer Applications, and she is now restarting after a break, and she wants to get into healthcare pharma domain, which I think even if some of our companies, I'm going to request them because 1 or 2 companies are interested in doing that. So over to Aarti Chavan to accept the certificate. I will call on her to take the certificate, and this is certificate. Aarti, you are there?
Yes, sir. Thank you.
Thank you. Thank you, Aarti. Thank you for the excellent performance in this exam. Let me tell you, sir, the exam is consisting of 3 midterm exam and 1 final exam and 1 also marks for assignment. So it is a total 400 marks exam, and attendance is also equally important. So with this, the students have cracked, and that is much appreciating. And the students who get higher marks are generally the people who are excellent in even what I say, big data analytics, including machine learning, which Cyrus sir teaches. Happy to introduce you to our youngest student in the whole batch of last 2 years, Akanksha Kankate. She's a now 3rd year B Pharmacy student, and without any experience, but she has also really, I'm very happy. She was more interactive, and she was traveling from one place to another. Her family support also was very good, and many of the time she could attend from mobile, but she did all the assignments on time also. That was her greatest advantage, and she's going to present what she learned to her teacher. And I have requested her that call me also. So I would also like to see what a young student can really get into. Sir, I would request you to give the certificate to Akanksha Kankate. Akanksha?
Thank you, sir.
Thanks. Now, This is the first batch where we had 2 pharmacists who had joined us, and she's from Harkishan Das. And I would say she's a very smart and fast learning student. In fact, many of the time she was working behind because her job is up to 10 o'clock and the classes were at 7:30. So one side she is working, dispensing the drugs and all those things are calculating, and one side she's attending the class, and right from traveling from Dombivli side. So her hard work I really appreciate, and she's very smart in her work. I am happy. I would have been more happy if assignments would have been submitted on time, but her knowledge and accuracy was much higher. So she has a 3 years plus of experience, and she wants to enter into a field there only in hospitals. So request you to give the certificate to Akanksha with her excellent good performance. Bhageshri.
Thank you, sir.
Thank you, Bhageshri. Yeah, she's on the job right now also. Gaurav Patil, again a PharmD student, so call them back to themselves a doctor from Indira College of Pharmacy. He's a clinical pharmacist intern. He has already worked in one of the analytical company for when the course was going on, he could get in. And now to get experience on the clinical side also, I think he has joined our Hinduja hospital in Mumbai as a pharmacist, clinical pharmacist there. And he wants to make his career in healthcare analysis or market analysis. Yes, Gaurav, please accept the certificate from Dr. Medhekar, sir.
Thank you, sir.
And excellent, congratulations for your excellent performance. Hitesh is not here today. So he's a senior pharmacist for 2 years. He has worked in 1MG, which is an e-commerce platform, more into digitization and business development there. And he has used, as I told you, the more analytical statistical models, which you or even our Shivraj sir was focusing on. And he was asking few always more questions and wanting to design more things for his own business. So that was, I appreciate him. He was one of the topper and he is having an outstanding performance. When we say outstanding, it is more than 85% of the marks he has got. So in his absence, I think we'll accept the certificate and we'll courier it the same to him, sir. Thank you. Rani Naik, a dynamic student, and though she is now with us wanting to get in from hospital, she was in a hospital for 2.5 years working as a pharmacist and analyst, but she wants to grow her career very fast. She feels that there will not be much growth. So she is coming into sales and then into marketing. Though I have recommended not to get into dental implant, but come into the mainstream pharma thing. So we'll be talking to her and then positioning her into a right company so that she comes into marketing like Satish in a very short while. Runali, I request you to take the certificate from Dr. Medhekar, sir.
Thank you, sir.
Thank you, Runali. Thank you. And you have heard the confident Rutuja talking. So she has done her BPharm from Nagpur and she has just a 3 months training experience. Though I was encouraging her to come to data analytics directly or management, she has taken a job as a, means not a job, but higher schooling into masters in pharmacy. And with that, she wants to get into R&D analytics. So would definitely help you after 2 years. We'll come back to you again. And there are many opening up in F&D and other areas. As sir also must have pointed, you must have heard to him that there are many things which are coming, including statistical modeling. If you know, then the jobs are much easier to get. So I wish you all the best, Rutuja, and accept the certificate from Medhekar, sir.
Thank you so much, sir.
Thank you. And keep up the confidence, Rutuja.
Yes, sir.
And we have Satish Kumar here, and all of you have heard him talking, so I will not talk much about him. Yes, but actually speaking, before the coming to the course, he has interviewed me for half an hour almost. What are the things and how it can be developed. So he was highly focused. That is what I appreciate about him. And thanks, Satish, and you are making us proud. Kindly accept the certificate from Medhekar, sir.
Thank you, Amrut sir, and also thank you, Ashish sir.
Thank you, sir. Thank you very much. So we have completed. We would request some invitee feedback. One of our past student is here, so I'll request him to speak for 2 minutes. Ashish, you are here. Ashish Kshatriya. He also was our student. He was an entrepreneur. He was into R&D. He was doing PhD. Then he moved into analytics. And after getting into now, after doing our course, he's working for one Japanese company. I was always telling him that from Nashik, you will not get a job. You come down to Mumbai. In fact, I was offering him to work in my company also. But then in Nashik, he got a Japanese company and doing very fantastic. I would like to hear from Ashish also for 2 words before we close the session today.
Thank you for
Yes,
introduction,
Ashish.
sir. So basically, I'm working remotely for the Japanese company. So they have that facility, so I can work from home. And this is a company which is working in machine learning as well as AI, and mostly in text analytics they are working, which I got to know after. So I have completed 3 months, and so this course has helped me a lot because when I got in this company, there were 2 more people joined with me. But looking at my knowledge of the data analytics, they have after the 3 months they have actually made me the project leader for some of the projects. So it is really helpful, and having a healthcare knowledge in an IT company and using the terminology of analytics is very helpful, which is which I learned in this course. So yeah, thanks sir.
Thank you for coming down, and I am happy. And let me tell you, he is also a student of our Bombay College of Pharmacy. But the person who forced him to attend the course was from New Zealand, who had attended our before his batch. He had attended from New Zealand. He used to come at night 2 o'clock from there, and he pushed him to do this course, and that's how
actually
we got Ashish with us. So thank you very much, sir. Anybody, if we want like to speak something, or we can close for the day. Anybody would like to add? Thanks. So before we close down, let me give a vote of thanks. And the first vote of thanks is for the students, because of you we are here, and because of you our course is going to be imbibing you and making us known in the industry, so that your working will tell people that yes, data analytics is to be done, and that is what will be our earning in our future. So thank you, students. And more than that, I always appreciate, and I've always said that Dr. Shiv Prasad sir and Nitin Manyar sir and Krishna Iyer sir, they have been very, very encouraging. In spite of busy schedule, you know that sir has also said that admissions are going on, working at both the end, they are doing the job, and in that busy schedule, they have come down. So I'm happy for that. And moreover, our chief guest and keynote speaker, Amrut Medhekar sir. So with my one request, he wanted, in fact, he is so eager to be connecting with the students. So we'll one day invite him to our Bombay College of Pharmacy also. And you must have seen that how in-depth knowledge and how scientifically he motivates the students. So we should certainly call him one day for Bombay College of Pharmacy also. And we'll take your advantage, sir, and freedom that since you have given us that we can associate with you in a greater depth. Thank you very much for being here and advising to our students. Moreover, my faculty, I am indebted to always, because they are always there for the students, whether any queries or anything. Those they don't say no, night 12 o'clock, 1 o'clock also, they sit with students for 1 more hour and explain in depth of it. And my past students and my current batch students, thank you very much for attending. I'm sure we would like to see a bigger good performance from all of you. I thank IPA, MSB and BCP staff also, who is helping me behind the back, and Navigo staff who is helping me for keeping all the track. Thank you very much to all of you. And
so before we log out, I think big thanks to Ashish sir for being a great host and a great teacher on behalf of the students and the faculty.
Thank you, sir. Thank you for your good words. And we will definitely like to see you again. And I might again invite you